this, what do they call it, food, desert food insecurity, that kind of thing. Won't that explode that statistic in terms of a lot of the communities that are currently having access to Head Start?
Absolutely.
Absolutely.
It will definitely compound the problem, particularly for those communities that don't have grocery stores or other facilities where they can buy, either fresh produce or food.
What's not talked about much, and maybe you can comment on this for me, if these programs go away, there are people by folks who have jobs. So jobs will be lost.
That's right. And
I'm not hearing much discussion about the loss of jobs.
well, yeah, obviously, when you look at impact, the impact can begin with the people that we serve. But you do bring up a very good point. It would certainly also have an impact on the organization. As we speak, some of our agencies have been laying off staff because they are, the stimulus funding, for instance, was really temporary. It wasn't a permanent increase, except for Head Start, where the increase was made permanent. But for the other programs, that funding, for CSBG, it was 1 year. Weatherization, we will be ending that funding in March of next year. And so a lot of our agencies who had actually ramped up and hired additional employees in order to fulfill the stimulus obligations have been laying off quite a number of staff. So, it is a devastating impact for those communities.
Can you touch kind of quickly for me in that environment, the morale of your members?
It's very, very dark right now. It's been a very tough year. As I said, we started off the year with trying to respond to these proposed cuts. And what I would also maybe just to inform your audience, the cuts that we were facing at the beginning of the year were actually twofold. First was proposed cuts for the current fiscal year, because Congress had not passed a budget for FY 2011. And we were in a continuing resolution. And so you had, in November, we had the election where you had a big shift in terms of control of the House and some new thinking toward the deficit. And so we were facing cuts for a year that we were already in, which was FY 2011. Fortunately, through a lot of community actions efforts and others, the Congress passed a continuing resolution to the end of the year, and we didn't face as significant. We did face some cuts, but not as significant as what they were looking at. But we were also facing 2012, and that budget hasn't been passed yet, but it's been a very challenging year.
I will have to say, and I wanted to add on, it's been rough, but I have to say we have a strong association. We have a wonderful network. And it seems like when times get down, get tough, that's when the network and the association are really out there together and really raising the questions and really informing people of what needs to be done. So I have to say the association does a great job of helping us.
The key word in network is the net. And it sounds to me that we hear a lot about Medicaid, Social Security, and the safety net. And it sounds to me like you're a major player in what we call a safety net. I see I'm getting time cues, and we're going to have to end this segment. I'm looking forward to getting you back so we can continue the dialogue. For you and our viewing audience, stay right there, don't go anywhere. We'll be right back with more right after this. We're back, and we're glad that you're here with us. We've got some new friends to visit and share with you. In this segment, we're going to meet with Sandra Juliff.
That's right.
Robert Wharton, Cook County.
And I'm from northwestern Illinois, about 2 hours west of here, and we have a 9-county area.
We want to kind of keep the focus on the CSBG discussion when we're going on.
That's fine.
We want to do something a little different where you're concerned, though. The programs that you have in your community. Tell us a little bit about a couple of them.
Well, one of the things that we do that may be a little unique is we have an alternative economic development project, which we call Project Employment. And what we do is assist people to obtain certificates, for like CNA certificates or truck driving or medical assisting, something that does not take a college education, that does not take a long time to do. And then at the end of that, we help them find a job in that field. And along the way, we give them some counseling, encouragement, help them to keep going so that they will complete whatever that certificate program is.
So the program itself is really about job creation.
It's about jobs, yeah. It's about jobs and getting people. That started as an outgrowth of our scholarship program. We do provide scholarships. We did 19 this last year. And those are either full or part-time scholarships for students at Illinois post-secondary institutions, colleges, universities, what have you. But what we found was there were a lot of people that don't have the interest in, don't have the time, and don't care to go into a full-time academic or even a part-time academic program, but do want to have some sort of a way of making money, and often that requires some sort of a certificate. So that's what we are doing there, is sort of filling that need and still doing the scholarships.
So that's an example of CSBG dollars creating jobs.
Exactly.
Okay. Mm-hmm. Now, if there's a cut in your funding, how would you continue that?
We probably wouldn't, though we try to find additional monies in one place or another. We're primarily a rural area, so it's a little bit more difficult to do that. Some of our other programs, we tie in with some other funding.
For example?
For example, transitional housing. Okay. We provide housing for folks both in units we own as well as units that we negotiate with landlords. And we use several different types of funding to do that. So if one goes, we still would have that option. For project employment, at this point, we don't have that option unless we raise additional money.
Okay. Are there any other programs you'd like to let our viewers
Well, one other thing that we do that we find is kind of interesting is that we discovered along the way here that a lot of our families that have children, those children tend to not be able to participate in activities like other children, like piano lessons or playing junior tackle football or this and Little League type of things that they can't participate in because they don't have the money for the fees that are necessary to do so. So we started a program that we call Youth Enrichment, where we actually help these kids by paying for fees and then following up, encouraging them, and to see whether they, whether this is helping them to get along with their peers and to feel a part of life instead of being excluded. And the idea there is to hopefully prevent some juvenile delinquency problems down the road because they are able to do what the other kids can do.
So as a matter of fact, I want to go to Mr. Wharton now because we got two community action agencies and they don't all wear the same face or service the same need.
Right.
Let's talk about CETA.
Thank you, Mike, and it's a pleasure being here this morning. CETA, as a community action agency, is probably the largest not-for-profit in the country. And we do a lot of different things, and we like to think of ourselves as helping people, even in the mothers who are pregnant in the prenatal, all the way through the twilight years, which some of us are in or approaching. There are a number of programs that, you know, could be considered unique based on community needs. And let me just cite a couple, which is a youth initiative, basically. Youth who have brushes with the juvenile system. The program is called Project Second Chance. And it connects young people who get in trouble in high school to the program through the courts. The judges actually sentence the individuals to our program. We have an alternative school. We make sure that they stay on track in terms of completing their GED if they can't go back into the regular public school, and they are given opportunities to visit colleges, etc. This program's been highly successful in getting a number of youth to not only stay in school, but to get their secondary education. And I think the key to these kinds of programs is that there's commitment by institutions within this community. For example, the school districts actually pay for the teachers in the alternative school. The program is located in the 6th District Court and is housed virtually without our having to pay the rent, etc. So I think utilizing institutions in the community and reducing those costs, which therefore creates a longer stability of the program, because it's not totally relying on public support.
You know, sometimes even folks in our viewing audience as we speak don't connect the dots in the sense that because of what you're doing, I would imagine the cost of housing them inside the criminal justice system is mitigated because you are keeping them from having to be
Exactly.
residents.
Also, expungement and other kinds of supportive services allow these individuals to maximize opportunity to find gainful employment as well.
One of the, some of the data recently has talked about the issue of food insecurity in your service area. Can we talk about that for a minute?
There are a lot of things that we're doing there, as you well know. And, you know, we have contracts with the food depository and, you know, in our service delivery area. And we have some of the highest food insecurity areas, probably in Illinois.
Help us out now, people watching. Food insecurity, that's kind of a new word,
Well,
but what does that
it's
mean?
a term used for households that are not able to have, you know, basic food items to eat. And in some of the communities, it's as high as 50% of the community. You know, you take a Fort Heights, in Chicago Heights, about 35% of the families there are not able to provide food on the table. So the terminology, it's like income insecurity
Gotcha.
instead of low income. It takes away the stigma of how people are classified sometimes.
Do you, have your data been able to help you analyze the impact where there's high food insecurity? Are there other social ills that crop up because of that?
Of course. I think education is one that is very noticeable because children often do not eat breakfast. They go to school. It impacts their learning ability, their alertness, their behavior, their development, and this is proven in early childhood development. So having an adequate diet is very significant, and in many of the communities there are no stores that allow people to purchase fresh fruits, vegetables, things of that nature.